This is for Zoom users. This is something I think they've introduced in the last 2 days that Miss Zoom or Mrs. Zoom says this meeting is being recorded. It took me by surprise. Heard that for the first time on Monday. Dr. Nick Rennick, welcome to the Tokyo Living Podcast.
Hello. Thank you for having me.
No, we really appreciate your time coming on tonight. We might just start. If you can give the listeners a bit of a quick bio of yourself, your career to date, and what brought you out to Japan.
Yeah, thanks very much. I'm Nick. I'm an Australian GP, originally from rural New South Wales in Australia. Then I went on and did medical school at Sydney University, and then further training as a GP in Perth. And basically, I'd always wanted to live in Japan and work here as a doctor. We have a very kind of difficult situation because Japan has bilateral agreements with the UK, with the US, where their doctors can kind of come over here and work with international patients. Unfortunately, our government hasn't been quite so proactive with those negotiations. So we are on equal playing ground with every other country in the sense that we just have to redo the examinations basically here, like the Japanese people do in Japanese, and redo our kind of intern training as well. So I just went through that. So I moved here last year, did the recertification, got a Japanese medical license, redid my intern training, and now here I am.
Wow, that's amazing. And so did you have to do the Nihongo Noriyuki Shiken level 1 as well, and
That's
then
right.
do the Japanese exam? Yeah.
That's
and I can remember, Dr. Lomax a couple of years ago saying, there's this Aussie guy who's saying that, he wants to give the Japanese license exam a crack, and we sort of just had a bit of a laugh, and then, a year or so later, it's like, he actually passed. So that's absolutely amazing.
It was a tough one, but yeah, look, it was worth it because I'm really loving being here in Tokyo. I think just being here with the international community, it's such a vibrant community here, and unlike I guess in a lot of cities where people of international black backgrounds just kind of blend in with the local population, here it's a very kind of close-knit place, and you've got people from all over the world doing all sorts of exciting things in Japan. So I feel really privileged, and definitely was worth the effort to come here.
Yeah, that's amazing. And where did you do your internship here?
So that was at NTT Medical Center, Tokyo. So I still work there. I'm in the general medicine department, seeing Japanese patients, and I'm also in the the Department of International Medicine, looking after their international patients. So we offer kind of primary care services all the way through to complicated tertiary care services. And I'm also working as a deputy director of the international patient office there. So trying to streamline, basically, because I think we've all, experienced trying to deal with the Japanese system as a non-Japanese speaker. And there often is just this complete kind of disconnect between what we want and what the Japanese system is offering. So I'm trying to kind of have a role in bridging that gap, working within a Japanese hospital, but sort of being able to talk to the other staff and say, look, this is what this patient wants. Can we just do it? So it's been quite an interesting, job there.
Yeah. And how long has that international clinic within NTT been in operation?
And so that's only been there for the last, year or so.
Yeah.
And so, yes, it's still very new, but basically the idea being that when people are referred to kind of see a specialist of some kind, that we sort of do a little bit of, making sure that they're well looked after from a GP point of view. But yeah, I'm very excited to have started work in the last couple of weeks with Tokyo Medical Surgical as well, which I'm sure lots of our viewers will potentially already have been going to. So that's an absolutely great setup. I always sort of, I get so excited, I even tell the patients about it. I say, this place is just like an Australian general practice clinic. It's like you're not in Japan, which I guess is something we can all appreciate.
Yeah. Well, you're certainly a busy man. We've got you on today. I know one of your passions is sort of, or interest is around the differences between the Japanese medical system and the medical systems in other countries, and sort of how health is addressed in those two countries. But I'll basically give you the floor and sort of start however you'd like, but maybe sort of talking about the Ningen Doku and sort of going on from there.
Yeah, so I mean, as a GP, in Australia, one of my key interests is preventative health. I very much like the idea that instead of just kind of waiting for people to have heart attacks, you try and get in there and prevent people from having the heart attack in the first place, because there's only so much that you can do after the event. And I'm sure someone like yourself as well, Sam, you're doing an amazing role in preventing heart attacks by keeping everyone fit and healthy. But basically, in Australia, we kind of have our Red Book, which is sort of like a Bible of preventative health, and we try and follow all the evidence-based recommendations in that. And in my training, there was a lot of focus on what to offer, but also what not to offer. There was a lot of, preventative interventions and preventative screening, which was actually not evidence-based, and that even when it was kind of properly studied, was found to potentially be harmful to the patient by doing it too much. I kind of went through my training with this very focus on each thing. Should I really be offering this service? What is the exact age that we should start offering mammograms, stop offering mammograms, start offering pap smears, stop offering pap smears, those kind of things. And then I came to Japan, and it was just bizarre to see the system of preventative health that they have here, which is, so they call them human docs, or ningen doku in Japanese. And many of our viewers may already be familiar and potentially have even attended one themselves. On paper, I guess they seem like a great idea. So you pretty much and they're privately run enterprises. You go to them and you pretty much just tick the boxes for what kind of things you want. And in Japan, they often have kind of made them into this really customer-oriented service. So they'll have the men's doc or the women's doc with the special premium package kind of thing. So you kind of, they kind of upsell you on all these extra tests that you can order and extra packages. I guess it certainly would give me the impression that, as a customer of that business, that if I really wanted to look after myself, the best way to do that would be to get the ultra premium package and just get all of the tests. And a lot of these tests will often include blood tests, but not just the sort of basic blood tests that a GP would order, but very complicated, rare, esoteric blood tests, particularly including tumor markers, which are extremely controversial overseas, and imaging as well. A lot of advanced imaging, MRIs in particular, are quite popular. Imaging which involves radiation, so CTs in particular, and even invasive screening, using various kind of endoscopies and things like that, are offered basically to any patient who wants it, without a lot of discussion of the risks and benefits to that particular person of doing that particular test. So to me, yes, coming from this Australian background and seeing the human doc in action here and just how differently people were thinking about looking after their health, it's a very interesting kind of contrast.
And what do you think has sort of driven that difference? Obviously, the way these systems have operated have developed over many decades. Do you think it's a science-driven thing? Do you think it's a cultural-driven thing? Do you think it's a business thing that's born out of these Ningen doctors trying to monetize that whole system?
Yeah, so I mean, certainly there is a profit motive. The human docs are incredibly profitable enterprises, but of course, I guess Japanese people want money is not really the final answer, because Australian people want money too. So I guess the profit motive is there everywhere. So the question is, why is Japan kind of their offering so different to what we have in Australia? I mean, in Australia, you can arrange private testing for certain things, but it's not very popular at all. I guess part of this comes back to the way our populations of the countries have envisioned, looking after their health. I certainly feel like in Australia, most of my patients, if you said, oh, we can do an endoscopy for you, if you pay this much, you can get a premium pack and we'll do a colonoscopy and an endoscopy for you, you wouldn't get that many takers. People wouldn't be queuing up to pay thousands of dollars to have those kind of tests done. I think a lot of Australians kind of subscribe to the if it's not broke, don't fix it. Don't go looking too hard for trouble. So partly I think there's a different mentality where the Japanese population is much more interested in finding abnormalities, particularly early detection of cancer is often kind of very foremost on their mind, that I've got to find every possible tumor that could be within me. Whereas in Australia, I think a lot of people, even trying to get them to participate in the government recommended programs is often a struggle. So there's that aspect of it. But I think in terms of unique Japanese factors, also the business practice. So often the human docs are actually paid for by the company. And certainly, even in my company, there was an option that I could, tick to kind of have a human doc arranged through my company, one of the premium packages. So yeah, there is certainly that. There's an aspect where corporate companies do that for their employees, and that's seen as a way of ensuring their employees' health, I guess. If you scan them top to toe every few years, they won't turn up sick.
Yeah, I guess the argument is, where if those resources are directed in the right places. I mean, obviously, those assessments are expensive, and if there's not sufficient evidence to support their use at certain times in certain populations, then potentially that could be looked upon as a waste of resources that could be put towards. I don't know. This is obviously my bias, but encouraging better activity levels and healthy eating and all that sort of stuff.
Absolutely, I reckon if we spent the amount of money that people were spending on their human doc, if they were spending it on gym memberships instead, I think or personal training, absolutely, we would see potentially better public health.
And do you think that that's perhaps why in Australia that's the way people approach health in general? That yes. it's more of an active prevention.
Yes, that's right. I mean, I guess typically, so because the human docs have evolved as an institution, often paid for by the workplace, there definitely is a focus on men. And so it's this idea, I guess, that if you're the Japanese salaryman, you work 100 hours a week, you smoke a lot, you drink a lot of alcohol. It's a nice thing if your workplace, and you don't have the time, obviously, to go to the gym or eat healthy or whatever. But if your workplace kind of will, keep scanning you at regular intervals to make sure they catch the cancers that your lifestyle's inducing, then at least, you can get treated and stay in the company, I guess.
I mean, if you, as a doctor, this is a pretty big question, but do you think there'd be a way to sort of merge, have the best of both worlds, and give people the best option, but I guess making it more affordable to the companies or the individual or whoever's paying for it? As a massive project and a dream project that's probably never going to happen. Especially in Japan, where things are obviously they move very slowly. But how would you sort of put it together?
I mean, I certainly think the answer is, of course, is not no screening altogether, and because we know that there are a number of screening initiatives which are very effective. So Pap smear program, the mammogram program, particular ages. Colonoscopies or fecal occult blood testing for colon cancer. So I guess it firstly is about looking very carefully at each potential screening and deciding which ones are actually worth it for that population and which ones are not, in a very evidence-based way. And in Japan, to be fair, they actually do that. So the government does have their recommendations. Ironically, though, their rates of doing the actual proper mass screening programs are abysmally low by international standards. So you have this strange situation where, say, the pap smear program, which is a cheap, effective intervention, has very low take up in Japan compared to Australia. There's sort of the percentage, I think, is about 30% or so. Whereas then there's a subset of women who are having their pap smears and also having millions of other tests, and there's a lot of women that are having no testing whatsoever, even the very basic stuff. So you're getting this big, and a lot of that, I suppose, is about it's who's working and who's not working.
Right.
So I certainly think if we were to try and do it as a more logical system, you would want to cut the workplace out of the picture completely and have it as a government-funded program and try and improve uptake into the government-funded programs.
Yeah. And I guess, if it was a government-funded program, then there'd be, I guess, from the government side, more push to make it more evidence-based and make it more cost-effective, and focusing on the things that really needed to be tested for.
That's right. I mean, and in Japan, they do actually already have government-funded programs for most of this stuff. Most of the effective health screening. So it's not as if it's not available. It's just that the uptake is quite low. And a lot of people just end up, instead of participating in the free programs offered by the government at their local health center, deciding that they would rather, get premium screening offered through their workplace, and that is paid for by the workplace.
Yeah. And is this in part due to a lack of education on, to the general public on, important things to screen for at, certain points throughout the lifespan?
Yes, I certainly think that there's not a very clear message on the risks and benefits of screening, which screening is appropriate and which is not. As I said, when you look at the menus of these, and they are called menus, of these
everything's
these human
called
dogs.
a menu out here.
So they have you get out the menu and you go, okay, I want the premium doc with the men's extra package. There's kind of never really an explanation from anyone about which of these is actually good for you and which of these actually is not good for you. And so certainly I would love to see someone independent kind of at the door of these places, kind of discussing with people about, well, okay, you're a 25-year-old female, maybe we don't need to do this and this scan for you because your risk is very low. But I thought I should probably explain a little bit more about, I guess, the idea, the potential downsides of over testing, because that's probably the missing piece in this equation. In Japan, the idea is fairly straightforward, and I think a lot of people have this same idea that, look, if you've got cancer and you find it early, you can treat it early and you won't die. So therefore, any test that can potentially detect cancer, no matter, look, it might only be partially accurate or whatever, but it's worth a shot. What's the harm in me as a male, 31-year-old male, to just get a scan and just check, for, look, I could have a lung cancer, I could have a bowel cancer, I could have a prostate cancer. The risk is low, but, better to be safe than sorry. Why don't we just test it and see what we find? And it is a very intuitive idea. I guess the things to be aware of is that every test has a limited accuracy. So firstly, we have the issue of false positives. So, and this gets a bit tricky statistically, but even a test with 99% accuracy, that's the headline, it's a 99% accurate test. If you're testing in a population where the pre-test probability is very low, so that's, let's say that the chance of me having lung cancer is 1 in 10,000, for example. As a young 31-year-old male non-smoker, very low chance. If I have a pre-test probability of 1 in 10,000 and I do a 99% accurate test, whether that's a blood test or a CT scan or whatever, and it comes back positive, what is the odds that I actually have lung cancer? And this exact same question was posed to a lot of medical students and a lot of doctors. And most people say, look, the test is positive, probably about 99%. I mean, it's a 99% accurate test. 1% chance of a false diagnosis. But if you actually do the maths on this particular case, the chance of a false diagnosis is 99%.
Yeah.
So the chance of me having lung cancer is actually only 1%, even though my test is 99% accurate. So certainly if you take a bunch of very young, very healthy people who have a very low risk of having a disease and you screen for that disease, even with a fairly accurate test, you get loads of false positives and only a very few true positives. And then, of course, those false positives then lead to, you do further investigations. So for me, I'm going to have someone stick tubes down my lungs trying to do a bronchoscopy to find that cancer that's not actually there, or that's just a pee that I inhaled a month ago. You're going to potentially have inappropriate treatment as a result of that, and a lot of the burden of the extra stress, of course, that causes.
I mean, it's quite different in a way in musculoskeletal medicine, but I'm a big proponent of very specific use of imaging, because I think when people have a musculoskeletal problem, I mean, the big one is sort of back pain. They get scanned. Most people, say myself, I'm the other end of the 30s. I would a 39-year-old. You add 10 years to that. That's a percentage of people your age that are going to have some sort of asymptomatic individuals that are going to have some sort of disc pathology on scanning. So they you go get your scan, shows some sort of disc bulge, disc herniation, and a lot of the time that finding isn't relevant, and then again can lead to all sorts of further investigations and unnecessary treatment, and a lot of times unnecessary surgery. And then even if it doesn't lead to that, it can cause a lot of other sort of psychological issues. Someone sees that bulging disc there on the scan, they start to freak out about it, they start to catastrophize, and that will oftentimes make the pain worse. So
absolutely,
that's from my end where I see overuse of investigations, and that's a big thing, big passion of mine, is trying to improve understanding around proper use of musculoskeletal interventions.
Absolutely, and you're a man after my heart with that. It's I'm sure you've seen the studies where they compare head to head. In half the patients you don't do any imaging, and in half the patients you do your advanced super MRI imaging. And who's got less pain 12 months down the track? It's the people that you didn't image. So actually, even just by imaging those backs and telling them, as you say, T2 doesn't look so good, that alone is enough to cause extra pain in a subset of people, often because they become scared to use that part of their body, because they're worried they're going to pop that hernia out further, or do something bad, when of course the real answer is to use it as much as possible within comfort.
100%.
So firstly, we've got the risk of overdiagnosis, which is a major factor in all of these. But secondly, we've also got often with CT scanning in particular, the risks associated with radiation exposure. And in a young person, we're still talking in the few per million kind of risks with most of these things. X-rays. So just as a primer, X-rays basically have next to no radiation. Simple chest X-rays, hand X-rays or whatever. You get the same amount of radiation. Going on a trip to New York from here, it's 3 days of background radiation. It's nothing. CT scans are about 1,000 times that. So it actually does slightly increase your lifetime risk of cancer. And in Japan, of course, where they love their scans, they love just checking, why not, just in case, they do see an elevated risk cancer attributed to CT scans as a result of that.
Really? Do you have any statistics on, if someone has multiple CT scans over the course of their life, what the increased probability of cancer would be?
So it certainly varies greatly with age. So, doing CT scans on a 10-year-old is very different to doing CT scans on an 80-year-old. I can't give you exact numbers off the top of my head, but it's for for like a 20-year-old, I believe when I've looked into it that you're still talking, 1 in 10,000 kind of the absolute risk increase. But I guess when you kind of put that into a relative risk increase, like, what was this person's chance of having brain cancer before the scan and after the scan, that risk has increased quite considerably because most young people are not getting brain cancer. So even though, we say that, it's a 1 in 10,000 kind of thing, even for a young person, obviously if you're at a high volume facility and you're scanning 20-year-olds day in, day out for their human docs as part of, good health for this employee, it becomes problematic at a social level. So I certainly would say, to everyone, look, if you need a CT scan medically, if your doctor feels that you need a CT scan to look into a particular symptom, then absolutely, I wouldn't hesitate. But when people are doing scans just because it's on the premium plan, that becomes an issue.
Yeah. I know Brian, who's the boxing instructor at our gym, had a fight a couple of days ago. Which he won. So shout out to Brian there. But the organisation made him requested that he do a brain CT just before the fight, which I haven't heard overseas that usually, if anything, they would request an MRI. And I think that's fair enough. But doing a CT instead just seemed a little bit strange. It's really just to clear any, which would be a very, very, very rare pre-existing condition that would put that athlete at risk of potential complications within the fight. But I think in the end, he just said, "Can I just get an MRI instead?"
Yes.
Fine.
And I'd certainly agree with, so I think in general, when you say CT, an asymptomatic person, and you're putting those together, that usually makes me very, very uncomfortable. There's not many situations where I would be going forward with that. And as you say, MRIs are a fantastic alternative. MRIs have absolutely zero radiation and zero downsides, except that they cost a fortune and you have to spend like half an hour sitting in a machine.
Yeah. Although, considerably cheaper here than in other parts of the world.
Absolutely.
And any other sort of, downsides to the system out here?
I mean, I guess so, potentially when you're going through these these human docs, the other thing that they do a lot of is tumor marker screening, and they do a lot of people, of course, because the name is tumor markers, it sounds quite straightforward. It's it's a sign that if that marker is elevated, you've got a tumor. Unfortunately, they're very non-specific tests. So again, when we talk about the accuracy of those tests, the accuracy of those tests is fairly abysmal. We're nowhere near 99%. Some of them are 20%, some of them are 60%. And basically, again, if you do that test on a bunch of asymptomatic people, certainly, in people who have cancer, sometimes it is elevated, but it's also elevated in a lot of normal people for no good reason at all. So, the tumor marker screening, which is very popular in Japan, and is also used diagnostically, by doctors who are, wondering if a person's got cancer, will often order tumor markers. Typically in Australia, in the UK, in the US, we're taught not to use tumor markers for diagnostic purposes. We only use it if someone's already got cancer. We use that to follow the progress of the cancer and potentially to diagnose a recurrence, but not kind of just to, order 10 tumor markers to see which cancer they may have. Because, of course, one of them comes back raised. You have to go on a whole fishing expedition to try and find cancer in a patient who doesn't have it. And it's not particularly comforting to the patient either to be told that, your tumor marker's elevated. We did some scans. We can't find anything. But see you later, I guess.
See how it goes.
I mean, of course, what often happens from the doctor's point of view is they do a whole body CT, which, as we discussed, is probably not a great thing. Whole body CT with contrast. So then you've got to do, one CT before and after contrast. And then when they don't find anything, they go, well, I guess we'll just do them every 3 months, or every 6 months and sort of see if we find one later, I guess, because it's a big call from the doctor's point of view, of course, to ignore a raised tumor marker.
Yeah, right.
So yes, you often when you do get an abnormality, it becomes this big sort of fishing expedition. But I guess there was one particular tumor marker which in Australia actually was used, and that's PSA. So PSA, of course, the prostate specific antigen, had a very complex history in Australia and in other countries as well, where for a time being it was very much a preferred way of testing for prostate cancer. Is just that everyone should come and have their PSA checked every year. In recent years, it's become much more controversial, particularly within Australia. And the RACGP, which is the Royal Australian College of General Practitioners, which I belong to, has pretty much stated that we no longer recommend that as an across-the-board test for everyone like we used to. It becomes an individualized decision, and each patient needs to kind of discuss whether they want to go through that tumor marker screening route with the understanding that it may detect cancer, but it may also lead them to go on a difficult sort of fishing expedition.
Are there elements of the way that things are practiced here that you would say you go back to Australia in 10 years' time that you would, sort of either you try to incorporate in practice, or you think that, as an entire system in Australia that they could sort of benefit from?
I mean, things that they do well, they got really good access to advanced testing, of course. So, advanced imaging, here it's just, as I'm sure you found as well, getting an MRI, getting a CT, it's like no problem here. Whereas in Australia, often we have difficulty, particularly with MRI access. So yeah, certainly if I could bring all their MRI machines back to Australia, that would be kind of handy.
Costs a lot of excess baggage.
That's right. Look, I think, I guess I'm sort of painting the Australian GP system in a very positive light, obviously, as an Australian GP. I must admit that there are cases where it doesn't work so well because it is very much dependent on the individual clinician. The kind of wait and see, don't do too much testing approach occasionally does let people down. And you do hear, horror stories of people who, were kind of just waiting and seeing for a very long time, and then had a very late diagnosis. So I think, certainly, potentially in Australia, if we could expand our access to advanced testing where appropriate, and expedite access, particularly to specialist level testing. So, in Japan, of course, if you want to get a gastroscopy or a colonoscopy or whatever, you really can get that very quickly here, which I think is great. That when you do need those tests, they're really available, and specialist advice as well is very easily accessible here. God, getting to a dermatologist back home, it was an absolute nightmare. I'd kind of have to ring them and be begging them to see the patient within a week, sort of thing. Whereas here, you can see any relevant specialist very quickly, which a lot of patients very much appreciate as well. But yeah, I'd take the MRI machines home. I'd take the specialists home with me. There's a lot to like about the system here.
Yeah. Well, I think that's a great way to close. I think it'd be great to have you back on the show at some other stage and discuss some other topics related to Japanese medicine and so the differences between the way things are done here. Anything else just in terms of what we've been talking about tonight that you wanted to close on?
No. Look, I think I guess it's just nice to be aware of of the different ways that they do things here, and I suppose being aware of that institution, potentially when some people are talking to their colleagues and everything, they hear about the kind of the way that they're thinking about their health, and how different it is to the way that we think about managing our health. It can be quite interesting.
Yeah. All right. Well, thanks very much for coming on tonight. If people want to find you, obviously, you said before you're now consulting at Tokyo Medical and Surgical. I believe it's a Monday that you're there?
Yes, I'm there Mondays and some weekends. So feel free to come and see me at Tokyo Medical Surgical anytime. or at NTT Medical Centre as well.
Yeah. The NTT Medical Centre, is that under Japanese health insurance? Can people see you under Japanese health insurance, or is that just privately funded?
So it's a little bit complicated at the moment. Generally speaking, we have been only seeing privately funded patients up until now, just as a new department. It hadn't quite integrated with the Japanese healthcare insurance system. From early June, they were planning to introduce a system where you can use Japanese health insurance with a co-payment. So which puts, to be honest, it puts our pricing on par with most of the other international clinics. But the advantage, of course, is that you can use Japanese insurance for the tests, those various tests that we talked about.
Sure. If you actually need them.
That's right.
All right, and to make an appointment at NTT, perhaps if we can, I'll put links in the show notes. But you do that online or just telephone appointment?
So phone or email.
Yep. Okay. And there's English reception access there as well. Yeah. Perfect.
Yep.
All right, Dr. Nick, thank you very much for your time, and
worries.
hopefully speak again soon.
Thanks very much. Good to talk to you, Sam.
All right. You too.
Bye.
Take care. Bye.